thank you for inviting me to come and talk today and raise awareness in your organisation about the menopause. My name's Alison and I work at City of Bristol College, and generally I work in the Trade Union Education Department. So I've been working with the trade union movement for quite a while now to raise awareness of the menopause and just to sort of give women a voice really in the workplace. I started running workshops around 4 years ago when the government put some money into research into women's experiences transitioning through the menopause, and I was asked to work with Bristol University, and we went round the country and we did lots and lots of workshops, just really raising awareness and just finding out about the experiences of women. It was focused in the workplace, so it was just really about how women coped with the menopause in the workplace. And it struck me, I mean, massively, just how much of an issue women transitioning through the menopause is to a lot of women in the workplace. And I suppose putting that together with my experience of going through the menopause, which wasn't that good. I was lucky. I had good support from my colleagues and I had good support from my manager. But I am very, very aware that a lot of women either don't have that sort of support or are quite reluctant to raise the issue of menopause in the workplace. So this session today is an interactive session, because one of the things I've found that I can stand and go through a presentation and talk about the menopause, but what we need to get people doing in the workplace is to actually have that conversation. Because once you start opening up that conversation and saying, this is my experience of the menopause, other women will talk about it, people will get to know about the problems that a lot of women experience. So the agenda for today is why the menopause is a workplace issue, and I'll talk a little bit around that. I'll also be looking at what the menopause is. And I think it was really weird that, I always considered myself to, be able to use Google to research and to understand things that are going on. But my menopause hit me like a complete shock. And I've since found out from running these workshops that isn't just my experience. That is an awful lot of women's experience of the menopause. So we're going to look at the symptoms and the signs. So by the end of that session, everyone will be sort of given an opportunity to have a conversation around those symptoms and talk about how that might impact on their colleagues, on themselves, or on members of their team if they are a manager. So that's the sort of interactive bit. Then we'll come back, we'll have a tea break, and then we'll come back and look at what can help in the workplace, the impact at work, and then finally what you can do as an individual to try and further the conversation around the menopause. So hopefully it's not going to be one of those where you'll be too bored by all my slides. Hopefully not. What I can't do is I can't see everyone. So I'm relying on my technical support there from Wesley and also from the other facilitators who have joined today to just sort of keep an eye on questions and, things that might go up in the chat. There will be an opportunity for you to ask questions and for us to have, sort of a conversation around those. So, but as we go through, I won't be able to see you, so I'm not ignoring you. I'm just ploughing through on the presentation until I finish the first bit. So hopefully that's okay. So let's start with why the menopause is a workplace issue. Because for a lot of people, the menopause is considered to be a private issue. And not something that you would take to the workplace or talk about. And maybe that is something that everyone believed to be the case, but not just myself, obviously talking to other women going around and doing these workshops, but also looking at a recent survey by BUPA and the CIPD, the Chartered Institute of Personal Development. I mean, they've estimated that close to 1 million menopausal women leave their jobs, which is a really, really scary statistic to look at. And I have to say that the experience I've had running the workshops leads me to believe that that is actually maybe the number or even more, because a lot of women have reported that they've left their jobs. Because when you think about the age when a woman transitions through the menopause, it's about the age in the organisation that maybe she's got to the level that she wants to be, and then suddenly she finds herself dealing with all these symptoms, which I'll go on to, and they find unable to continue in their job, so they leave. So that is twofold. I mean, one, obviously for the woman themselves, they could be, talking about not paying as much pension because they're taking a lesser paid job, so that can lead to, sort of more poverty in retirement. But for businesses, they are losing the experience, the knowledge of women in their 50s or 40s and 50s when, and having to recoup that, knowledge and take people on. So for businesses to tackle the menopause in the workplace, it just makes sense. It really does. It's a very taboo subject. I get that. I'm going to talk about signs and symptoms, and for every woman, you might want to share that, or you might want to keep that to yourself. What this is about is to try and open that conversation so more women feel able to actually talk about what they're experiencing, and so they can share it. We found that women that raise issues around the menopause, obviously there's an embarrassment for a lot, but there's also fear of ridicule. And I think that, we see everywhere that women have not got, the equality that we need. And, by maybe raising an issue like this, they might think, well, maybe my line manager is going to think, well, actually, she's going through all this. She's not going to want to maybe go for promotion or maybe, take on, additional tasks at work that will further the career. The government funded research that I did with Bristol University was very, very clear in that women at the time, a few years ago, had little or no support in the workplace around the menopause. It has got better. The next slide is around what is the menopause. So let's have a conversation about what the menopause is. So first of all, I do want to say it's a natural process. All women will go through the menopause. Also, people, from non-binary, transgender and intersex communities as well. So if, that is part of your team, then you also need to be aware of that. The menopause is defined when a woman's periods have stopped for 12 months, 12 consecutive months. So once you've had that 12-month gap of not having a period, then you are postmenopausal. You have gone through the menopause. The main sort of ways that you go through the menopause, there's the natural menopause, and that's the one that most women experience. And that is when you have naturally reached the end of your reproductive life. And that is the natural menopause. The premature menopause, now this is something that 1 in every 100 women will experience, and they'll experience it before the age of 40. So, it's not just about, natural. There seems to be many, many different reasons why premature menopause happens. So women just need to be aware if they're starting to get some of the signs and the symptoms that I'm going to talk about, that it could be a premature menopause. And then there's a medical or a surgical menopause. That is the result of when a woman has had a treatment or a surgical procedure, and basically wham bam straight into menopause overnight, and start to get the signs and symptoms that maybe a lot of women going through a natural menopause, it might gradually happen. To those women, it just happens immediately. The menopause occurs, and now the ages are 45 and 55, and I think for a lot of women this is where it's a bit of a shock, because a lot of people think that the menopause happens to women later on in life, but actually from the ages of 45 to 55 you start experiencing changes, and those changes are known as the perimenopause, and that's the main bulk of your menopause. You will be in perimenopause, and this is when the hormone changes start, and you start to get that lead up to the menopause. There are two main hormones, estrogen and progesterone, and generally they work together, not always in harmony, because women have very, very different menstrual cycles as well, but they work together to regulate the menstrual cycle. And what happens when a woman hits the perimenopause is these levels start to fluctuate, and they can fluctuate, quite a lot for a lot of women. And you start to notice maybe your menstrual cycle becomes a little bit less predictable. And then these hormones are the things that lead to the menopause symptoms. So the symptoms, but I just want to say a little bit about the hormones and what they do. And I also should mention that when I talk about the signs and the symptoms, for some women, they will tick one or two. It will be, yes, I get, this, or I get this. For some women, they will tick more and more. Every woman has their own menopause, and you can never compare it to another woman's, because it is your menopause and it is your hormones and it is the changes in your body. So just because one woman has so many symptoms, another woman might not. So I don't want people sitting there looking at this and thinking, because for not all women will have all of these symptoms. So estrogen, a very, very important hormone. And this is the hormone that triggers the release of the egg every month for fertilization. So it's very much about keeping a woman's body ready for fertilization. It nourishes your body, it keeps the blood, it keeps you youthful and elastic. That is the role of estrogen. To what level it does that, then obviously women will have different ideas. It regulates the bones and the cholesterol. A lot of women complain that they get high cholesterol levels as they go through the menopause, despite not changing anything about their diet or their lifestyle. And it keeps organs as brain, liver and heart all very, very healthy. And it maintains the brain power. So a lot of women will talk about, we will talk about the impact on the brain power for some women. And progesterone, that is another, hormone that has really, really important part to play. So things like feelings of calmness, helping you relax. It's linked to your sleep pattern. And again, when we look at the symptoms, you'll see that a lot of women talk about their sleep pattern being completely upside down once they start transitioning through the menopause. It helps normalize blood pressure, it increases your pain thresholds, it can improve your mood, and it plays a central role in pregnancy. So, final hormone that I will mention, which is testosterone. And testosterone is often known as the mojo hormone. It's the one that keeps you motivated and optimistic. It helps with sex life. It supports bone density. A lot of women have broken bones as they transition through the menopause more easily than they would have done. It does all these sorts of things. It helps turn fat into muscle, improving function, and keeps liver and heart healthy. What happens as a woman transitions through the menopause is the levels of testosterone also reduce. So you've got the three hormones all, sort of fluctuating and doing different things. So you can see that, at that time in your working life, you can be dealing with lots of things. And I'm going to go on to talk about the symptoms. Hot flushes, I think that's the main symptom that women, or everyone, is aware of, actually. There's all that whole, as women go through the menopause, they have hot flushes. What comes with those hot flushes that isn't often known about is things like palpitations. And a lot of women will experience palpitations. You then go on to the night sweats, where you can be disturbed 2 or 3 times in the night with really, really powerful night sweats. Insomnia and sleep disturbance, another thing. So this is that whole sleep pattern that's been sort of taken and just sort of thrown out the window. So already we're talking about things that are going to mean that for some women, when they go to work the next morning, they haven't had a lot of sleep. It can lead to fatigue. A lot of women talk about headaches and migraines as well when they transition through. And then you'll get various joint aches. I mean, one of the main joints that seems to be affected, a lot of women complain about shoulder issues and shoulder pain. So they're obviously going to have an impact on your day. Other symptoms include dry skin and irritation, You increase your perspiration during the day. You can get dry eyes. You can have hair loss. You can have a lot of problems with your bladder, vaginal dryness, itching, discomfort. And one of the things that a lot of women find is their periods suddenly turn irregular and they get very, very heavy. And that obviously has its own sort of discomfort during the day. Some of these symptoms that are not well documented for a lot of women, and I'll talk about myself here. When I first started transitioning through the menopause, I sort of knew that I would get some hot flushes, so I was quite aware that I would probably spend a lot of my time fanning myself in various sort of meetings. I also sort of knew that, my periods were going to become more irregular. And, a few of the other symptoms maybe, I was aware might happen. What I wasn't aware of was the psychological symptoms. And these psychological symptoms are the symptoms that can often lead to, women just leaving the workforce, as we've already said. We know that it happens. There's an increased, you're increasingly likely to become very depressed. Anxiety. Now, the anxiety, I'd never experienced anxiety, but I experienced anxiety as I transitioned through my menopause. And that manifests itself in so many different ways. For a lot of women, they find it difficult to do certain things that they were always, okay to do. For my industry, I was in education, so I found it increasingly more difficult to walk into a classroom. And, often some things, the anxiety then leads to panic attacks. The other thing that I found was, poor concentration. And a lot of women talk about the fact that they suddenly go from being, excuse me, absolutely on the money in terms of being able to concentrate to just being all over the place. The changes to mood, the problems with memory, excuse me a sec. The problems with memory, for a lot of women, that's very, very scary because of the link with Alzheimer's. And, a lot of women think, why is it that I can no longer remember what I've walked into a room to do? And all that leads to this loss of confidence. And the loss of confidence can dint anywhere in your working life. It's just, really, really difficult to deal with maybe, public speaking or anything that you might need to do, dealing with the public, making quick decisions in your professional life. That sudden loss of confidence can really impact on that. I'm going to stop and just see if I can pick up on any questions, because I think someone said there were a couple of questions.
I think there was just one.
What was the question? Sorry.
It said 1 million women left their job, estimated over what period of time, please?
Good question, because they weren't that clear actually in the research, and I've tried to find that question out, so I'll try and go back there. I don't think it was stated in the report that I read, so that's a really good question.
I think that might be the only one. Not sure. Hang on. Is the impact worse for someone that may have already suffered with psychological symptoms prior to the menopause?
It can be, yeah, it can be, because obviously if you're already, for example, maybe you're already experiencing depression, then the tablets that you'll be taking will be, linked to that, and then this whole hormonal imbalance can just hit you again. So yeah, I suppose I would be someone who would talk, maybe if someone, was open about the fact that they had issues before, then at least if they know that there could be an impact from the menopause, because I think for a lot of women, they didn't know. It's not stated quite clearly, and for whatever reason, not everyone reads all the research into something that might be happening to them. Some women will, some women won't, but I think the women that I've worked with in the workshops, it was the psychological symptoms that they weren't aware of beforehand that hit them really hard. So I would imagine, yes, anyone who has got history of suffering from anything like that, then they would probably need to be quite careful and talk to their GP to try and get some advice on that.
Yeah. The next question, how do you unpick what is the menopause or what is other things / stressors?
Really good question. It's very, very difficult. What GPs tend to do is look at that age range, 44, 55, and think, okay, if you are telling me that you're experiencing these things, they tend to just decide that is the menopause. And there is a lot of things that women will get alongside that. Again, I can use myself as an example. I was diagnosed with an underactive thyroid, and for anyone that might have had an underactive or has an underactive thyroid, a lot of the signs and symptoms that you get with that mirror the menopause. So my menopausal symptoms were my underactive thyroid symptoms were missed for a long time. And I think that, a lot of GPs aren't specifically trained in the menopause. There are menopause clinics, but currently in a lot of areas, there's, a 4, 5, 6 month waiting list for women to be referred to menopause clinics. I think, the COVID pandemic has, added, the time factor onto that as well. So I think that if you are experiencing menopausal symptoms and you're of that age and you go to, just keep a diary, just keep a note of everything that's happening, because yes, it does mask. And that's the problem that GPs have, that they just automatically assume. I mean, there used to be an argument for taking blood tests. But what GPs have said is the blood test only shows that snapshot of that day that they've taken the blood test. So a lot of GPs now won't refer women for blood tests, particularly at the moment with, everything that was recently going on with the lack of, equipment for blood tests anyway. But you generally won't get, I would imagine you would only get sent for a blood test if you were experiencing a premature menopause or you had symptoms around that time.
Cool. You kind of half answered this one. How do we know the GP is recommending the best therapies for us?
And this is the problem, and this is the problem that women have had. I mean, the government have just announced a new task force to look into the experience of women in menopause. And I think part of that, needs to be, looking at, the medical profession as well, in terms of the GPs and their understanding and training in menopause issues, rather than maybe or putting more money into specific menopause clinics where women can be referred to someone who understands and is okay, with prescribing certain things for women with the menopause. But yeah, I think that we're still at that time where the menopause, we're making more noise. We were on the news last week, famous faces were outside Parliament, cheering on the fact that women are no longer going to have to pay every month for their prescription for HRT, which is great because menopause is on the table and we're talking about it, but we're still not at the stage where I think the infrastructure is there in the GPs to support all the women that are going through this.
Cool. The next one, are the symptoms more severe if the cause is due to medical procedure?
I think that, I don't know whether they're worse or better, but they're sudden. It comes on but I think if you go through that sort of medical procedure, you also are prescribed and talked to about options for making sure that, your hormones won't go skew with, whereas a natural menopause, it sort of creeps along, and before you know it, you suddenly realise that, you know, you're either absolutely exhausted because you've had no sleep, or you're dealing with going into work every day and realising that, you know, your periods are so irregular, you're not prepared for, you know, things that might be happening. So, you know, a lot of women spend their menopausal years, you know, with a little bag with them, you know, with things in that they're going to need in the workplace. And that's the reality of it. And the reality up until now is that it hasn't been talked about in the workplace, or women haven't been able to say, look, you know, I've come to work, I'm just about to go into a meeting, but I've just had, you know, the worst period possible. I need to, you know, sort myself out, or I need to do this. And that hasn't been, you know, the sort of thing that women have found that they can do. So they've just sort of snuck off and tried to, you know, and it's about, I mean, there's an oversharing issue, you know, there's a whole thing about, you know, oversharing on menopause and things like that. You know, I don't think I'd want to come into work every day and my line manager greet me with a smile and a how's the menopause today, Alison? You know, that's sort of going too far. What we want is that thing that if I come into work and I need something specifically related to my menopause, that I feel that I can talk to my manager and I won't be judged and I won't be penalised by it. You know, we're not at that yet. And that's what these sort of let's start to talk about menopause workshops are, you know, raising awareness with women that the things that they are experiencing is actually down to the menopause. It's a natural process. You're not going mad. You're not the only person that is dealing with these issues. You know, 50% of the workforce are women. And I would imagine in healthcare that, you know, that's a bigger percentage as well. So, you know, your colleagues are either going through the same thing, about to go through the same thing, or worried about, you know, what might happen to them as they transition through the menopause. Because 44 is quite a young age to start all these hormonal changes, and particularly for women who maybe have left, you know, starting their families a little bit later, might struggle, you know, and for some women, you know, to reach the menopause and be told that's it, you don't need to use contraception anymore, you're off and about, that's it. For that, it's a real relief. But for some women, it's actually really, really traumatic, because that is maybe, you know, the end of their journey to try and start a family. So the later women are leaving the families, the more issues are, you know, sort of coming in with menopause.
Cool. Next one, if the definition of going through menopause is 12 months of no periods, do those symptoms stop then? That is not my experience.
I would love to say, no, that's it. Once you've gone that 12 months, that's it. A lot of the symptoms do for a lot of women. However, some women report that in their 70s and 80s, they're still experiencing hot flushes. So, you know, again, it's one of those, every woman is different. Certainly, most of my menopausal symptoms disappeared. Most of them did, luckily, you know. And I've spoken to so many women now in all these workshops, and there really is a mixed bag, but generally you start to feel better. However, some do linger. And I'm sure if there's, you know, other women on the call that are postmenopausal, they'll probably be nodding in the fact that, you know, yes, we still do get hot flushes and night sweats.
Can symptoms fluctuate over time, particularly in the early onset?
They do. I think all women, as I said, all women experience their own menopause. But yeah, some months you will find things worse than other months. Again, it's this whole hormone fluctuation, you know, it depends how your hormones are behaving for you, really.
Can you only get referred by your GP, or is there another way to access this clinic? Do you know what the waiting times are currently?
I don't know that there's any other way. There might be some private menopause clinics, I'm not sure. But certainly the NHS menopause clinics, it depends on which part of the country. I know someone in London who's been referred recently, and they've got a 6-month wait to get an appointment at the menopause clinic. So I'm assuming that a lot of clinics will be the same. And I do know that because of the pandemic, referrals stopped to menopause clinics. So there's obviously going to be that backlog, as well as new women being referred as well.
Mm-hmm.
So if I leave the questions there for a minute, because I do want people to get a chance to have a conversation. Wesley, have you stopped me from being able to share?
No, you're able to share.
My computer then, so I don't think you'll be able to see this. So I'm just going to say what we're going to ask you to do. What I'm going to ask you to do is, well, Wesley is going to break you off magically by the power of Teams into smaller rooms. And I'd like you to spend 20 minutes discussing, now you've sort of realised all the different symptoms that might affect women transitioning through the menopause. Have a conversation about how those symptoms might affect you, your family, your friends, or members of your team, depending on where you are in terms of the menopause journey. If you could ask someone in your group to just make a few notes. We won't have a massive amount of time to ask to get feedback from every single room, but we would like to just pick up on some of the relevant points that you might have discussed. So have this opportunity to start that conversation, and actually, if you're not experiencing the menopause, then just think about how those symptoms might impact on your team. And then we'll call you back after 20 minutes. Room 1, I don't have a list of who was in room 1, so I'll just hope that someone will know that they were in room 1, and maybe just feedback some of the issues. Obviously not everything, we don't have a massive amount of time, but some of the issues that came out from your group and how they thought it would impact on women. I'll just ask for a spokesperson to step up.
Okay, shall I go?
Lovely, thank you,
Can you
Jeanette.
hear me? Yeah. Okay, so we had a really interesting discussion about how symptoms might affect ourselves and others. And we talked about anxiety. We talked about difficulty in getting to work. We talked about being short-tempered and how that affects family life, and also the difficulty of having a hormonal teenager at the same time. That was particularly challenging. We also talked about how menopausal symptoms affect our partners and our work colleagues, and there was a conversation about losing confidence actually in our ability in the workplace. We had a really good example of somebody that was very well supported, in her own words, through menopause, and how the flexible working policy had been really valuable to her, and also that they were having an ongoing discussion, which was really lovely to hear, actually, that whole ongoing discussion about how she currently is. So that was good. And then we kind of wound up by talking about the involvement of men in the conversation, and the fact that actually it's really important because it's everyone's business. So that was our group.
Thank you. Yeah, absolutely. And sadly, the experience that I've got from running the workshops is they are majoritarily attended by women. We're getting very few. However, the few men that did attend the workshops, of each one has actually spoke to me afterwards to say, how interesting and how much they didn't know and how much they do now know, and wish that other men would probably come. So we just need maybe that cohort of men to attend, and then they can sort of spread that word around to make sure that we get them attending, because it does, it affects men in their working lives, and it affects men in their home lives as well. So yeah, thank you for that. Next person, I'm just scrolling down. So we've got Deborah speaking for room 5 in no particular. Oh, sorry, Leslie, did you have a question? You've got your hand up.
No, sorry, I was only going to speak for our room, so don't worry, I'll wait until after Deborah.
Okay, thanks.
Yeah, hi. So a lot of our conversation kind of went around, I mentioned this perhaps at the end, like apps and books and stuff like that. So it seems quite interesting where some of the ladies are quite knowledgeable on those kind of things. So I'll mention those in a minute. Same really with Jeanette, headaches, migraines, not wanting to go to work, and that was one of our ladies looking at her mum, and she was dreading anxiety setting in as well. Perhaps the same lady or another had stepped down from a senior role 10 years ago and is questioning now whether it could be depression related or confidence related. And the fact that one of our ladies has stopped periods several years ago, didn't associate joint pain with being to do with the menopause, but particularly in the shoulders, thought that it was arthritis, comes on in the evening and then contributes to poor sleep. And then poor sleep obviously having an impact on work-life balance as well. So I think they've mentioned in the chat session, but there was some interesting app. There's an app called Balance where you can record your symptoms and use it if you want to go to the GP. You can log things like your mood. Another mention was a Davina McCall programme, which would be quite interesting and perhaps something that her partner could watch at a later date. She was, and maybe leaving books lying around was another tip as well. So I've gone off course a little bit. Another app called Health and Her. Yeah, and a book by Dr. Louise Newson, Preparing for the Perimenopause and the Menopause. So that's all quite interesting chat in our room 5.
Thanks, Deborah. I mean, I'll look up the apps because I've not seen those. But yeah, any sort of book or anything that you can recommend to other women in the workplace is great, because that means that, they can also, catch up on their knowledge as well. So that's brilliant. Thanks so much. Leslie?
Yeah, that particular app and book was also mentioned by somebody in our group as well. It was quite interesting because some of us were going through or had gone through the menopause, and a few of the others were coming along today just to find out what support there was and what lay ahead, really. A couple of our members of our group mentioned problems with memory, brain fog, and how that term in itself almost, trivialized what was happening to them. Also, accompanying this, the lack of confidence. And one particular person mentioned how their workplace had lost somebody with like 30 years experience because of the symptoms she was going through at menopause, and it was almost felt better that she sort of go, not realizing what it was due to, not attributing it to the menopause. We discussed the menopause and relationships, and one person said she and her partner have a rather interesting method. He, rather like a football match, he has red and yellow cards that he produces. She's never got to the red card yet, but she's had a yellow flashed at her on several occasions when perhaps, she's obviously her mood swings and so forth are affecting her. Largely it was about the psychological effects of the menopause. Sleep pattern, again, was flagged up, and someone said about hair loss as well. Whether that could be attributed to that. Again, it was difficult as to whether it's menopause or whether it's something else. And in addition to the app and the book that have already been mentioned, somebody also mentioned the closed Facebook group, Menopause Matters, which she said was really, really helpful. And it's a closed group, so obviously, nobody outside of those people can, read what you're saying.
Oh, that's good.
That's it.
Yeah, thanks, Leslie. I didn't know about the Facebook page, so that's something I'll investigate as well. So excellent. I think room 2 is that.
Yeah, I'll have an opportunity to feedback on behalf of room 2. Hopefully, I've captured enough notes to summarise the conversation. But there were some really lovely open sharing of experiences from people within the group, and a couple of the themes that came up were how the symptoms can actually creep up on you as well over a period of time, and that, you know, it's not this big bang thing, it's the fact that things can creep up over time, and then you start to realize, hang on, what's going on for me here, and starting to try and unpick it, but it can be very gradual, and therefore it's not always obvious. Was a key thing that came out. And I think one of the real things that came out in our group was the crippling anxiety that people have experienced, so much so that it can, you know, mean that people have ended up being signed off sick from work because the anxiety has been so severe. Somebody in the group has made a decision to retire early because of the impact of the symptoms and the anxiety. And also the feeling that sometimes having to just try and cope and try and hide the symptoms and just try and keep going, you know, is really, really tough in the sort of work environment, because many of the professional roles that people do across health or you know, the local authorities, you know, we're in professional roles where there's an expectation that we can cope and we can be resilient and we can continue to deliver our jobs. And actually the symptoms have been so impactful in some situations where people have gone to do a presentation or gone to do a piece of work activity and have literally been stopped in their tracks and not able to do something that they were always freely able to do before. And that impact then on decisions that people make about their work, whether it be, you know, to actually, you know, completely stop work altogether, I think was quite striking in the conversation that we had. And different symptoms, I think what came out was what you had already said earlier, Alison, about the individuality of it. So for one person, their experience can be very different to another. And one lady shared the fact that she's experienced fainting when she's been in heat, which had never been a problem for her historically, but now is quite a significant issue in terms of overheating. And when you're in a role where you have to wear PPE for your job in the summer months, how challenging that can be. So some really interesting insight into the sort of personal impact on an individual basis for people in certain job roles came out in the discussion that we had as well. One member of the group sort of shared the support that they'd had from their daughter, who was in her early 20s. So actually, I think, you know, some of them mentioned about if you've got hormonal teenagers and you're going through it, but actually for one individual, they shared how brilliant that their daughter had been in terms of support for them. So some nice sort of stories there in terms of support from family members. So hopefully that sort of summarised. We talked a lot about a lot of stuff, but hopefully that summarises some of the things that we captured.
Lovely, thanks Melanie, and absolutely right to keep mentioning that everyone will have their own individual menopause, and not every, you know, not two women will be the same, so that's really important. Thanks very much. Who else have I got? Andrea? I'm not sure what room.
Hello, I have no idea. I didn't even see the room number. So, but yeah, I think first of all, I'd just like to thank the people that were in the space with me, who really bravely started the conversation, because I wasn't brave enough to start it. So I do want to kind of thank colleagues in the room, and hopefully I can kind of just reflect back. There's lots of common themes, and I think the bit around making it everyone's business, I think Jeanette, right at the outset, you kind of said that. So there's absolutely something around how do we have some inclusive conversations from people up and down the organisation, and kind of including men in those conversations, but also that we do also need a space for ourselves where we feel safe enough to have those. And I think it's the good to talk bit. And sometimes we might feel that there is a safe place, and we might want that enabled as managers and leaders for kind of colleagues to have those safe spaces as well. So to kind of encourage people to have time to have conversations about it. I think that reflection about how everyone's really different, that also came across in our group, and we had a range of experiences from people who from one end to the other, and I think a recognition that we've got some kind of real learning from those experiences and expertise kind of within the groups, and to kind of hold on to that as a point of kind of learning and reflection. And also, I think it's sometimes quite difficult to, and I think it was also in the chat bar, where we might be in perhaps male-dominated teams. I know on the whole, some people are working in environments where it is mainly women, but for some people it might be upwards. It might be that they're managed by a group of men. And how do we then have conversations where we feel comfortable to kind of raise issues surrounding this? So there was a lot about that, the importance of having support in and out of work, the benefits of flexible working and working from home came out, and yeah, I think it's about how do we kind of recognise this as a life journey that we can all have conversations around. So I think those were the kind of the main themes really, and I think there was a real willingness to kind of learn, but also how do we kind of create those spaces as kind of leaders and managers as well. So yeah, we've got the space within our work environments to do it. I think that's most of it. Thank you.
That's lovely. Thanks, Andrew. Yeah, I mean, I think it is really important to have that space and that place where, the stories that we're hearing already, that people have stepped down from senior positions, people have, brought on their retirement early and maybe leaving, that's what we want to stop. We want to give, that proper chance for women to make the decision based on not their menopause, if you know what I mean. So thanks for that. I've lost count now. Can next person just sort of Denise? Lovely, thanks.
Thank you. I believe I was in room 7, and again, thank you for everybody who was there and shared their experiences. A lot of the themes that we've already touched on were raised, but within our room there was a lot of discussions around symptoms that they were experiencing at times within their lives where they were facing personal challenges, work pressures, moving house, a lot of the things that would normally cause some stress was just diagnosed as just that, potentially depression, and it's only perhaps with hindsight or even hearing the discussions this morning that they've identified that possibly that was actually the menopause that they hadn't recognised, nor had their GPs. And alongside that, we had a lot of discussions about HRT, some of the reasons why people feel uncomfortable maybe about taking it. We touched on the Davina McCall programme where there was, and I'll let you have the responsibility of this one, Alison, because you know far more about the bad press and the link with cancer. And a question that came up a few times, if a menopause has been misdiagnosed or the perimenopausal and a person's been put on antidepressants or something like that, would there be any benefit to taking HRT when you're potentially halfway through the menopause?
I mean, my belief on this is that there's never a bad time to start taking HRT if you are mindful to take HRT. I don't want to sit here and say HRT is the be all and end all, but if I don't think there's a time limit. I think the hormone, I mean, HRT will replace estrogen, so a lot of the issues that you get, and if you're on a double one, that you'll be replacing estrogen and progesterone as well. What women are saying at the moment is it's very difficult to get GPs to prescribe testosterone, but that's what I'm hearing. That's not anything that I've researched properly. So all those symptoms that are going on throughout the entire perimenopause, if you start taking a supplement to that hormone, then it sort of addresses the balance. I believe for some women it takes a while, to get the right mix, because there's so many on the market. But, my belief is at any point during your transition through, then it's never too late to take any hormone therapy that you are prescribed.
And the other topic was this lack of confidence, and we explored the reasons why perhaps we are inclined to just ignore symptoms, carry on, accept that maybe we're not working to the best of our abilities, but then we are probably doing an awful lot more than we used to. There's more workload, so we're actually doing ourselves down when we shouldn't be. So they were the main topics.
Yeah, thanks, Denise. Again, anyone want to just shout out and help me out here with the...
I don't mind going next.
Miranda, lovely.
Reflect back that group. Yeah, we had a bit of a discussion. Thanks everyone from in the group for contributing about how the sort of a lot of press around menopause is negative. It's all about all these bad things that are going to happen, and how and relating it to puberty really, and how puberty people don't go, oh no, that's terrible, it's going through puberty. It's about understanding and sort of adapting. So we've talked quite a bit about that. And how it's a life stage, you know, it's a normal life stage, but there was a very big difference in experience in our group. I know other people have said that, and one person particularly sailed through menopause, and other people have had issues, and we talked about the physical versus the psychological, and generally the feeling was, I think, that physical symptoms we sort of knew about those, but the psychological symptoms came as a complete surprise, and if we'd known more about the psychological symptoms, it would have been a lot better at self-care, a lot better at looking after ourselves, and actually a lot better at supporting work colleagues, if you know, we knew more about that. I think that was about it.
Yeah, I think in terms of that, Miranda, it was interesting. I can't remember who made the comment about actually if there was something that could be done about memory and concentration, and I think that maybe is something that, you know, organisations could look at in terms of, you know, strategies. When, you know, I'm only guessing because obviously, you know, you work for, you know, in health, so I'm thinking, you know, what if you were forgetting, you know, medicines or something like that, you know, what strategies could be put in place, because actually you might be a brilliant worker, but for some reason you're just not connecting with this. And I think there's strategies for everything to help memory. So I think that was a good point that was made, that actually we need to focus more for ourselves to try and, you know, keep that memory and try and keep it, but recognize that actually I'm forgetting about that. So I mean, I have a world of post-it notes, you know, that's my memory. You know, if it's not written on a post-it note, then I'm likely to forget it. You know, I never used to put a timer on when I cooked, for example, but now if I don't have a timer on, then I forget that I'm cooking. So there's always strategies that you can use. It's not as if, you know, we're saying, oh, my memory's gone, that's it, I'm no good anymore, throw me out with the, you know, with the bath water, so to speak. It's like, okay, let's see how I can actually manage this. So excellent. And I think there should be a couple more.
I was going to do talk for room 8, if that's all right.
Louise. Yeah, great.
And then I'll do room 5 afterwards, or room 6. Sorry.
Sorry, Julie, I beat you to it slightly. So I think probably as a room we talked about. It seems like, you know, lots of people have talked about the same sort of things. Interestingly, I asked everybody in our room, there were 6 of us, how many people had considered leaving their job, and there was 2 of us out of the 6. One of us had considered leaving their job because of the menopause symptoms. One, not directly because of menopause, but maybe because some of the difficulties associated with some of the symptoms, interestingly. So, you know, 2 out of 6, I would say, is quite a high statistic if you kind of multiply that. But we found that a number of us in the group had not expected some of the symptoms that had come along with the menopause, and I think most of us had felt fairly unready. One of the people in our group had felt that, like, they wanted allowances for how they were feeling, but definitely not special treatment. And some of the more severe symptoms, you know, massively impacted on their day. So poor sleep, increased anxiety, lack of confidence. There was a couple of us that had started new jobs this year, and they've, you know, as most of you are probably aware, with menopause symptoms, then obviously things like anxiety can become exacerbated. So it would impact more in a new environment, a new job, new people.
We talked about learning to mask how we were feeling, and sort of feeling like people don't really understand, and putting up a facade and maybe overcoping with symptoms, feeling uncomfortable about talking about them, feeling like the onus is on you to talk about it rather than your workplace being more mindful, maybe. That some of your symptoms might be related to that. One of the people in my group worked in a very male-dominated environment. They're not working in health because obviously this is through Eventbrite, so not everybody works in health that's on this session. And just finding that really difficult to have to sort of navigate their way through their day, their week, amongst a group of men that it's really not on their radar at all. And then talking a little bit about, sort of being around family or colleagues, how that can affect how people perceive you or how you come across, and obviously the impacts on our families, our loved ones, husbands, partners, children, when you've been overcoping all day and feeling like you're doing a good job and then coming home and letting rip on the people that know you the best. So we talked about memory, brain fog, and I talked about this being one of the biggest symptoms for me and having to adapt. So yeah, post-its, I have notebooks for everything. All my meetings that I have to attend regularly, I have a notebook so I can pick it out. I can't pick things out of my head anymore, and I had an excellent memory, almost photographic, so I could remember lots and lots of stuff, and now I can barely remember my name and words for things. So in short, I think that's probably most of what we talked about, Alison.
Thanks, Louise. That's great. Yeah, I mean, the memory, I think I liked what someone said earlier about calling it memory fog is sort of making it a very trivial thing, but actually it's massive, particularly in some workplaces. And I think I probably told this last week, apologies if I did. I remember coming home one day and saying to my partner in the kitchen, can you put this in the cupboard? And he was like, what cupboard? I said, the cupboard that we keep cold things in. And he was like, do you mean the fridge? And I said, that's it, fridge, because that word was absolutely nowhere in my brain, and that was just, and I think it was at that point that he realised the impact of the memory, because it's as if the words just go. What I've learned now is if I don't try and chase the word, if I just don't try and look for it, then about an hour later it'll pop into my head and I'll think, there you go, which is absolutely no use when you're in front of the class, because you can't say to them, I'll answer that in an hour, because my brain might work by then. I mean, I'm sure every student in my class would think, oh, I think I'll about leave now. So thanks for that, Louise, that's brilliant. So Julie, you were next.
Hi, I think for our group it was the sort of diverse point that we were coming from, that there was two of us that were menopausal, post-breast cancer and hysterectomies. One lady was potentially a very early menopause because her mum had an early menopause and she was seeing all the symptoms. And another lady had low thyroid, underactive thyroid. So all of us weren't coming to the menopause from a central point, if you like. We all had other issues that were part of it. For all of us, it was very much how long is it going to last? And at one point, one lady sighed, and we just like, that says it all, because we don't know. If we had an end point, could say, okay, so I'm going to be over this in 5 years, it would be much easier. But we don't know what it's going to look like for everybody. It's all going to be very different. And I think that lack of understanding of what's out there, if you can't take HRT for whatever reason. I don't know whether anybody else thought it, but the Davina McCall one I had to turn off halfway through because it was all about HRT, and I thought it's not for me because I can't take it. So what is there? And I spent 6 months with very, very, very bad hot flushes, to the point that I was fainting and 40 a day, sweating through and thinking there's nothing I can do about this. But actually, when I plucked up the courage to go to my GP, she prescribed me clonidine, which controls my hot flushes. So there is help out there, but it's just that message of go to your GP, go and find out what there is. If you can't take HRT, that's not the only answer. But I think work-wise, a lot of people are saying it's difficult to work in a male environment. I actually find ours is quite a female environment, but if your line manager has sailed through her menopause, she doesn't. The comment I got this week is, are you happy for me to attend this? Does anybody else want to attend this? Well, yes, you can attend it, but I'm fine with my menopause. And actually, I'm thinking it'd be really good for managers to have an understanding when they're doing supervisions about how it might affect people. But that's, where we were coming from.
Thanks, Julie. Yeah, absolutely. And I think that, there are a lot of women, which is brilliant, that sail through the menopause. I mean, good grief, I would hate to think that, I would wish some of my symptoms on anyone if they didn't have to have them. And I think, they will have some empathy, but maybe not the empathy of someone who is experiencing it in the same way that male managers won't. So I think that training that's done for senior, that needs to be done for managers, has to include female managers as well, because we need to pick up on the fact that, it's the same for everyone. If I'm sure that if we were in a room full of people that had flu last year and they all discussed their symptoms and how they felt, there'd be one or two that sailed through this flu business and is not, and doesn't understand how someone's still in bed at the end of the week with it. So it is about finding people to be allies. We're looking for our allies. We're looking for people to align themselves with our issue and say, okay, I've never experienced it, or I haven't experienced it to that level, but I agree and I understand that women do. So therefore, you're starting from that base of how you help those women, because then if you help those women, you help all women. And that's, and in some in a lot of industries, you help those women, you also help the men, so, for a lot of things that are put in place because women might be asking for them, it's not exclusive for women a lot of the time. Men will benefit as well. So I think that's a really good point to make. Now, I know I'm not brilliant at maths, but I'm sure, is there anyone else from any of the other rooms that haven't reported back that want to? I'm not going to go around and force anyone, but is there anyone left that wants to speak on behalf of their room?
I haven't reported, Alison. So, I won't talk about the symptoms because obviously, a lot of that's been talked about. I think one of the things we were really interested in is how to support staff through this, and also when if we've got somebody sat in front of us, and we think, oh, this might be perimenopause or menopause, it's broaching that and thinking, at what age? I don't want to offend anybody, but if somebody at 40 is sitting there and I'm thinking, oh, this might be menopause, we don't want to offend anybody. So we talked about that. One of the ladies on our group is having problems sleeping, and she was very talked to us about that, was very open and honest about it, and then said didn't know if she needed to go to the GP. And we basically said, if you were a member of staff sitting in front of you, what would you say to your member of staff? Go to the GP. So we talked about that, and we also talked about banter in the workplace, because obviously, some of us make a bit of a joke about it because it's, sometimes it's embarrassing, isn't it? Hot flushes, forgetting words, etc. So we have banter a little bit, but it's recognising that some of us are quite happy to laugh, to have a bit of a laugh about our symptoms, but not everybody is. It's just being, thinking about people in those circumstances as well. We had a gentleman in our group, and I'd like to clone him really, because he wanted to find out lots more and be able to support people. So I think this is just so good. I think for all of us that are on here, it's probably a bit of therapy for us all, realizing we're normal, but also just educating as many people as we can. And I think certainly just talking about it just open and every day, whereas when I think about in my mum's generation, it wasn't talked about at all. Just that open and honest conversations that we're having, I think it is going to start getting better for people.
Thanks. I think so. I think that for the first time we do make up 50% of the workforce, and that wasn't always the case in previous decades. Certainly not women making up, numbers in workplaces that had a voice. A lot of women worked, but not in senior positions, and we know this. We know from history that women haven't been the decision makers. We are getting better, you know, and if you look back to the 60s, my you know, experience of my nan was when, you know, Valium was the thing to do. So women that experienced a lot of the symptoms that we're talking about now were prescribed Valium, because that, you know, was supposed to keep them quiet. But a lot of women weren't in the workplace in the way that we are now. You know, we make up, you know, half of it. You know, a lot of us are managers. You know, so we've got that decision making avenue now that we never had before. So I think when people say, why is it now that you're all talking about the menopause? Because we can, and we're able to, and we're in positions where if we are talking about it, people can't turn around and ignore us. So, and I think, you know, the more voices we have in the workplace, the more allies, you know, like the participant in your group that actually is here to learn more and understand more. You know, I think that's just, you know, that's what we want, really. That's what we're asking for. So anyone else before I move on to what we can do? No? The second part of today is a bit about, yes, now we understand some of the things, and the conversations that came out of those rooms is brilliant. And you know, what I have found running these workshops, I think I liked what was said there about them being a little bit of therapy, because it is sometimes, you know, a chance. But ultimately, we have some legislation in the UK that protects people at work. It's not necessarily often thought about in the same line as the menopause, but we do have health and safety legislation. So, you know, employers have to look at the health, safety and welfare. And I think what came out earlier was about the different hotlines that a lot of organisations have. You know, it's just a case of saying it's brilliant that employers are, you know, having well-being hotlines and things like that, but just make sure that the people on the hotline are aware of the issues around the menopause, and it is something that they think about to discuss. Risk assessments are a really useful tool for women that are maybe experiencing severe menopausal symptoms. You know, don't be afraid to go and talk to your manager and say, you know, actually, I think that there needs to be some sort of assessment of my role, and see what, you know, can be done to support you through that. We've got the equality legislation, and, you know, more and more women, and I believe from ACAS, hearing from ACAS at the moment, which is the organisation that keep an eye on the sorts of employment tribunal topics, and the menopause is an increasing issue, being where women are using the menopause. So there's been lots of tribunal cases that women have managed to take cases to tribunal, and they've won on the grounds of, sometimes it's been age, it's been sex discrimination, and we've also got disability discrimination as well. So the law, even though it's not specific around the menopause, it is still there to protect women in the workplace, and to say to employers, look, you need to take this seriously, because this is impacting on health and safety. The sorts of things that can help you manage the symptoms. Now, I appreciate that this is a general list, and for some of you, you might hear one of these and think, well, that wouldn't work in my workplace because of. But if that is the case, then think, but what could maybe help? So we know that working in an area with ventilation, not only for the menopause, but obviously now because of COVID as well, you know, ventilation is key. Some workplaces, there aren't access to drinking water. It's really important that access is changed, if that's not the case, to make sure you've got proper toilet and washing facilities. And again, you know, I'm not expecting, you know, employers to turn around and build, you know, shower blocks and everything else. But look at what you've got existing. Is there something that can be used? Certainly, I work in a college. I know that there are shower facilities in the college. So it's just making that aware, really, of, you know, to everyone, to say, look, you know, if you do need to have this sort of support, then it's there. Now, PPE, that came up earlier, obviously with you know, COVID, there's a lot more of work of people being asked to wear different types of PPE. Even just for a lot of menopausal women on buses and trains that are using masks, it can add to hot flushes. So it's just about being aware of that and making sure that it is appropriate PPE, that they've not, you know, they're not giving you things that actually you don't really need. Health and safety aside, you need to obviously look at the reason for the PPE. For uniforms, there's a lot of organisations that still, you know, buy uniforms without consulting their their members of staff, never mind whether they're male or female members of staff. But certainly if uniforms is something that is prevalent in your workplace, then have that conversation. Make sure that you can have a break. Again, it's not always possible, I know, but it's worth thinking about, you know, how you could actually build in a break, which will help with an awful lot, not just with being able to go to the toilet when you need to, but also with some of the psychological things that we spoke about earlier. And if your organisation has a menopause policy, then, you know, make yourself aware of it and make sure that, you know, you do actually use it. I mean, what helps you manage the symptoms? You know, I think one of the groups mentioned about excessive workloads, and I think that has been an issue, certainly in some industries through the pandemic. But, you know, excessive workloads will exacerbate any menopausal problems that you have. So, you know, if there is a way to manage that better, then that is something that you could speak to your line manager about. Stress definitely impacts with the menopause. So again, you know, if you can reduce that, you know, we need to try and make sure that there's more awareness amongst managers and colleagues. And I think that's come out clearly today that, you know, everyone needs to be able to be aware of the issues and to be able to talk about the issues. Negative attitudes, and they are everywhere, you know, and they will be negative attitudes from maybe women that have gone through the menopause and are looking at the next generation coming through and thinking, well, we didn't get any help. So, you know, you just need to grit your teeth and get on with it. You know, there will be negative attitudes from managers as well. They'll be unsympathetic. There will be there'll be unsympathetic colleagues. And it does take quite a lot to challenge those colleagues. And that really is something that you should seek support for. And if the organisation is open and talking about the menopause, then actually you might feel that you can report more, because we do know that women are bullied and harassed because of their menopause. And that leads to women feeling that they have to hide everything, and we're just going backwards then, which is not what we want. So what employers can do to help? Well, first of all, they can arrange for training for management and for all staff. They can make sure that they talk to the trade unions in the workplace and make sure that the policies are developed. Because if you've got a menopause policy, a good menopause policy, then it just makes such a difference to women. Ensure that assessments look at the needs of menopausal women. Establishing points of contact, again, that can be, you know, a senior member of staff, that can be someone from the union, it can be anyone in the organisation that actually becomes that focal point to say, do you know what, if you can't talk to your male colleague team, you can come and talk to this person. Improve access to support, and just encourage that culture when menopause can be discussed safely. Is finding that balance between being able to talk about it without feeling embarrassed. But as an individual, it's sort of looking at what you can do. So you can support your colleagues. They might be having issues, so it's good that, you know, you can sort of be aware of that and try and support them. If, you know, there's any workplace campaigns, so if, for example, Unison wanted to survey to find out the scale of the problem and you're a Unison member, then, you know, take part or join. Support any negotiation of any policy, but just get involved in workplace groups And I think that workplace groups, you know, I've called them menopause cafes here, but they take many forms. And because we are a little bit isolated now with the whole working from home for a lot of people, maybe set something up on Teams, if you're not, you know, meeting face to face, something that, you know, women can just go and have a chat, particularly if you found today that, you know, it was quite useful to just talk to other women. You know, imagine that in a more informal environment, where you can share things. And treatments. And again, you know, that disclaimer that I'm not a medical person, but these are the sorts of things that are there. So the first thing, and again, I think, you know, that comes back to what Julie said earlier about it's not all about just going to the doctor and taking HRT. You know, find a good GP that you can talk to and explain your symptoms. And if HRT isn't suitable, then, you know, there are other alternatives. I've not listed everything because I don't know them all. But there's also a lot of herbal remedies that some people find useful, you know, if you don't want to go down the HRT route. One of the things that I found useful was the CBT, was the behavioural therapy. And when we talked about the psychological impact of the menopause, I found that the treatment I had through CBT was really, really effective, and it's accessible. It was done, you know, online most of the time with some telephone, no face-to-face conversations. However, the strategies that they talk you through, I still use, you know, and I think that, you know, for any person who maybe is worried about some of the psychological impacts of the menopause, when you do talk to your GP, also talk about CBT therapy, and ask about that. There's certain lifestyle choices. I think these lifestyle choices are the lifestyle choices that doctors will talk about no matter what ailment you go to, and quite rightly they are about losing weight, taking more exercise, not smoking. However, you know, what I don't want it to be is about, you know, if individual women don't help themselves, then, you know, why should the employer? Actually, some of those lifestyle choices will help and some won't, and for some women they're not able to go down that route. So it's about sharing information with other women in the workplace. It's about making sure that you have that conversation and you talk to them, and that's the important thing. So I'll just stop there and see if there's any questions about that. Any comments or questions? No? That's okay. I'll just check the I can't see any questions in there. That's okay. So I'll move on to the next bit. Okay, so again, we're going to put you into smaller rooms just to spend some time thinking about what do you think should be done at work to support women transitioning through the menopause. You know, any suggestions, anything that's working for you at the moment? I think during the last feedback there was some conversation around support that people had received. You know, what do you think that your employer or your colleagues could do to support women transitioning through the menopause? And Wesley, over to you. Okay, so I'm just going to try and develop some sort of checklist around things that you've all sort of decided in your group might be the way forward for actually supporting women with this. So once again, I don't have a list of rooms, so I'm just going to ask someone to jump in on this one. Laura?
Yeah, thank you. We were room 1. So initially we thought that sort of being able to signpost and know where to signpost was really important, so that we can get help and advice with maybe workplace adaptations or work pattern adaptations. But that actually opened up a conversation about women potentially hitting triggers through absence at work. And one colleague actually mentioned that she self-referred to occupational health with her symptoms, and that was a really, really positive outcome. So I think as a manager, I wouldn't particularly think of referring somebody to occupational health. Maybe if it became a long-term absence, but initially maybe I wouldn't think of occupational health myself for the referral. So it's nice to know that somebody had such a positive experience and got a really, positive outcome and a lot of support from the occupational health therapists there. I think agile working and the continuation of working from home, mobile working is a really good idea. And that helps people maybe if they just, need to start later or take breaks, or maybe if they've just got days of particular sensitivity or symptoms that they just don't particularly want to maybe or feel they can be in front of the team that day or that morning. And it just allows people to be at home and maybe have their camera off if they want to and just deal with the meetings that they have. But it's, just to continue that agile working that we're maybe doing now. And I think we touched on this in the other meeting, but products in washrooms just for, times of emergencies, really. You might be at an office that's not your location, or, if you're often working from home and you can't get into town to get some sanitary supplies, it's nice to have those. Even if somebody mentioned, those vending machines that used to be in all the toilets that got taken out, even if they were put back in and people can buy products. Some companies do actually put products in washrooms where people can leave a donation, but often people find that they're quite empty or sparse on products. So just somewhere where people can buy products. And then I think the common theme was just management awareness. People have been off with symptoms relating to their menopause, and during their return to work interviews, they're just told to go and see the GP. And I think that's the lack of understanding of some of the managers of our staff.
Yeah, thanks, Laura. I think for a lot of women, they're reticent when they come back to work to say the real reason they've been off. There's so much sickness and diarrhea that gets put down on sick notes because that's the least. It's really weird, isn't it? Oh no, it's diarrhea. It's diarrhea. When why aren't we embarrassed about that? So it is sort of a thing. And I particularly like the fact that if someone has referred to OccuHealth and they've had a positive experience, and that encourages other women to do that as well. But I think you're right. I think in terms of trigger points, a lot of women are hitting trigger points. And by the return to work conversations that you can have, as a manager with your team, could actually really support women in that and say, look, if this is menopausal, then maybe we can look at this in another way. So I think that's a really good point. So thanks for that. That's great.
Thanks.
Anyone got anything to add to our checklist from your groups? Oh, I've got a hand up there. I can't see the name. Fiona.
Joe.
Oh,
sorry, I can only see me. You go, Fiona.
Are you sure?
Yeah, please do.
Just following on from that, in our group, we actually said, why on our return to work forms, why isn't periods or menopausal symptoms listed? Because actually, if you've got that listed on, it gives you permission to be able to talk about that with your manager, and actually says, you're not hiding it. It's, and actually then you've got the data then that actually will help drive change within an organisation, because you'll have that data ongoing. So I'm going to take that back, and actually I've just asked a question of my manager, because I don't get to see, I can't remember what the return to work forms are like. So I've just asked her, are they? And I'm going to drive that forward with with HR and stuff, and actually try and get that listed on Dorset Council, because that would make absolute sense to me.
Yeah, absolutely, definitely. Maybe that is something that, you know, can be taken up as a suggestion. And Jo, you were next.
Brilliant, thank you. So I think one of the things that came through from our group that was really helpful was around connection. So whether that's through a group at work, or whether it's through a session like this, actually feeling like you're not alone, and there are other people out there as well that you can talk to and sort of share experiences with. That was really helpful. And there was another point about being more aware of yourself and knowing that actually what you're experiencing is a symptom of the menopause, and being able to be open about that and to say, do you know what, today is not a good day and this is why. But that obviously takes a lot of confidence and a really supportive team as well. But that's something that can help at work when you're actually able to recognise in yourself, and then to be more open about that as well. We spoke about management as well. We did speak about male managers, but in a way I think we need to talk to more men, don't we, and understand what they need, because we're saying all men don't understand, but actually we don't know that your male manager hasn't just supported his wife through the menopause. We're assuming, aren't we? So I think it's really important we have a conversation with all managers as well. There's nothing to say that a young female manager would know any more than a sort of a male manager. And then we also talked about the home working, so the pros that have already been mentioned around having your bathroom next to you and being able to get a drink and being able to turn your camera off and things like that. But then also some negatives about home working, with like lack of connection and losing confidence as well in yourself and your ability when you're away at home. So those were the kind of key themes from We Will Remate.
That's great, thanks Jo. Yeah, certainly that whole feeling alone business is coming out more and more as people are, you know, at first the home working was, yay, you know, we're going to be at home. And I think, you know, after a while people did get to feel more and more isolated. So good point, thanks. Jeanette?
We talked about, from a support at work perspective, we started off by discussing having a menopause policy and the importance of that. And that discussion continued along the lines of the real importance about changed behaviours. It's not always a policy that fixes it. So, you know, role models and changed behaviours and visibly being supportive. We talked about the importance of discussing openly, as many people have. We talked a lot also about inclusive culture, and we had a conversation about the similarities with disability discussions that had gone previously, and that was a really interesting discussion. There is a thing called a reasonable adjustment passport, and that's a document that really details how we can make this easier for you. And I thought that I hadn't heard of that reasonable adjustment passport. So it's really about the adjustments that are necessary. And we also talked a bit about personal stories and just the sheer impact that they can have, the importance of those personal stories, because stories are what people remember. So, you know, that was really important. We talked about women's networks, and those are more common. And obviously menopause is on their agenda. We had a discussion about who starts the conversation, actually. So is it, you know, where does that conversation start? Is it the male manager or the female manager or the individual? And we talked about the vulnerability, actually, that needs to happen. And also the fact that it's not just men that find it difficult. Sometimes younger women don't understand the impact of it either. So, you know, that they're not particularly well informed. So we talked about the importance of education, of course, and finally we looked at wellbeing conversations, and we likened it to an appraisal type discussion, and we were talking about how that wellbeing conversation might be might be had. You know, how do we really get into that language, and just making space for conversation in the workplace.
Yeah, no, absolutely, yeah. I mean, you know, as a younger woman myself, I never gave it any thought, you know, and why would we? And I think the point was made earlier about, you know, younger women and male managers. You know, why would they if it isn't anything that had affected them? But in terms of starting the conversation, I do think, and I know I think it was said in the small group I was in about, you know, is it, you know, if a manager brings up that sort of question, could it be your menopause? You know, is that sort of going to be, are women going to find that a bit? Well, I think if there's an open culture and the culture is around, you know, actually it's okay to talk about this, it's not going to impact on you, then I think, you know, it's quite reasonable for a manager to turn around and look at and say, you know, they can do that caveat and say, I do know that there are premature menopauses, so you know that could be, you know, so they're not sort of saying, oh, given your age, then so there's ways. But I think the conversation needs to come from the top to begin with, and then that means that everyone can then feel, oh well, we can talk about this, we don't have to hide it. So yeah, thanks Jeanette, that's great.
Okay, pleasure.
Deborah? Yeah, I'm on it. We talked quite a lot about the menopause policy as well. So one of our ladies in the group was in HR within the council, and they were working on their menopause policy yesterday, interestingly. And we kind of went from there. So a really good quotation was making the organisation a menopause-friendly organisation, a recognition of equality issues, to create training, to create a supportive environment, and the policy needs to, quote, this organisation values the contribution of mature women, and there was something, where has that gone, selling positive menopause, training about memory and concentration to be written by a psychologist. So they didn't want to be looked at as a woman with a bag of symptoms, so needing positive language. And then there was just a quotation that the downside perhaps of things, some women may use menopause as an excuse to not performing, so that may have a knock-on effect. And I think that's about it.
I think that, yeah, I mean, I don't know, in terms of you know, women sort of blaming something that they haven't got, I don't know. I mean, I would imagine that maybe there are, you know, but it's not going to be a commonplace thing that, you know, that you would sort of say that. I think what was interesting in the group I was sitting in was talking about it was the question and answer session that someone suggested around, you know, having, you know, someone clinical to come in and answer questions. You know, some of the questions that have come up in the chat today that, you know, I haven't been able to answer because I haven't got that clinical background. You know, I think that was another thing that I quite liked. You know, what are clinical remedies, what are herbal remedies, you know, just to, you know, sort of give women more choice. So thanks for that. That's brilliant, Deborah. And Denise?
Yeah, I was in room 4, and thank you very much for everybody who shared. We touched on a lot of the topics that have already been mentioned, but I think one of the issues that we discussed was the challenge of hot desking, and just how important the ability to control your environment is. Working from home, yes, that's useful, but if you've got your own place at work, your own drawer, you could have supplies if you needed. Within our organisation, there's a move to no pedestals, just a bare desk with a locker away from where you're working, so it becomes potentially, we all work in health, but we all have our own personal privacy. You're going to walk over to the locker, that's not seen as very nice. You can't necessarily choose to sit near a window if that's going to be best for you. Fans, even prior to COVID, were not acceptable for infection control, and that's become much more established. And the other topic we explored was the need for awareness of all staff, your younger colleagues, and also the men, to understand what it is and what format we need to create to encourage the men to join in with this topic, and whether or not it would be appropriate to set up men-only workshops. Exclusion doesn't necessarily sit well, certainly with me personally, but it may be, as one of the contributors in my room said, that there would be a more open and honest flow of conversation. So whether or not we could canvass what interest there would be in a provision of a workshop for only men, or where men have attended the work group, perhaps reach out to them to understand why they felt comfortable to help us sell it in the right way.
Yeah, thanks, Denise. Because I think part of the impact of today has been hearing the experiences, hasn't it? You know, of women in the workplace and what they've felt and what's happened to them. And I suppose, yeah, it would be great to get some feedback from, you know, some of the male participants to, you know, get their sort of take on it and how they could, you know, maybe spread the word as well. So excellent. Anyone else?
I was in a session. I'm sorry, I didn't take the number of the session, but the main points that have been brought up already were covered in our session. Some of the general things that we came up with was that everyone should be encouraged to attend a training from all backgrounds of work life. People of our, you know, women going through the menopause, women pre-menopause, obviously male colleagues, younger colleagues, all managers, so that people can support each other and have an understanding of the symptoms that ladies of our age are going through. There was a lot of praise in relation to the different companies that are represented here, i.e. Dorset County Council, BCP Council, PHP, to say that they were good, that the doors were being opened and that these sessions were being offered to people, and that in PHP there's a great HR manager who has put a spotlight on the menopause, and some of the other organisations have information on their intranet, so that's great. We're moving forward. Something that I noticed when I booked this session was that there was one date available, and there weren't any other sessions, so I'm kind of hoping that there'll be some more offered, which would be wonderful. And there are a couple of comments about the use of humour for people that are going through the symptoms themselves. One lady said that her best friend said that her cardigan would become her best friend, which is wonderful. And we also discussed a couple of symptoms that weren't listed. For example, weight and weight gain, and also a symptom that I've experienced is sniffing, whereby I constantly have to have tissues around me all the time because I've got to that age where I find that I sniff more, and one of my work colleagues explained that in a bit more detail. There is a reason behind it, but it's something that I remember my mum experiencing and my grandmother experiencing as well, so I noticed a symptom of the menopause. And one of the big points was that we all listen to the individual, because everybody experiences the menopause in different ways. There was one lady in our group who was very fortunate that she has only had very small symptoms of the menopause, and she felt that she was very lucky. but there was other people in the team that in the group rather that had much more severe menopause symptoms, and that the individual being listened to is the most important thing.
Absolutely, yeah. And I, you know, I'm like a collector of symptoms for my slides, and that's a new one on me, Zoe. So thank you for that. I'm going to look into that, because that's not on my list. You'll probably find it will be on my slides next time. So thank you for that.
Super. Thank you.
Sorry, if one person's discomfort is another person's joy, really, isn't it? You know, they've added something onto the list, so that's brilliant. So okay, so we're coming to the end. I noticed that we did have a post from Pete, thanks, to say that, you know, not keen on segregated groups, inclusive culture. Yeah. You know, you're always going to have that argument there, but I think so. I think what's been powerful today is hearing, you know, as I say, the impact on various women in the group of their menopause, and you know, and the good stories as well about, you know, support for some people, you know, good experience with occupational health, but you know, then there's the downside of maybe, you know, a lot of women that are suffering in silence. So it's great to have that positivity as well, that you can, you know, sort of say, well, actually, you know, if you do speak up, you know, it's nothing horrible is going to happen to you. So as we're close to finish, is there anyone, I don't want to cut anyone off, that has got anything else to say about that? So anyone, shout out now. No? Okay. So the final bit of today is for you to use the chat button yourself, because what we found was really effective last time when I asked this question, and this is like a pledge, and it's a pledge, you know, what are you going to do when you go back to the workplace? You know, to you know, a pledge to yourself and a pledge to your work colleagues as well, of what you can do to improve the situation for maybe someone you work with, and a pledge for you. And it might be a personal pledge, it might be that you as an individual are going to go and find out about you know, you know, a bit more about the menopause, or you know, anything. And we had some great things that came out last time, so just using the chat button, just make a pledge. Excellent. Yeah, absolutely. Raising it in meetings, you know, talking about it. I like that. Make my male sons more aware. Absolutely, Sarah. Yeah, being supportive, being kinder to yourself. Absolutely. Yeah, products in toilets. I mean, I know a lot of organisations where the women have just banded together and, you know, just put a little basket in the staff toilets of things that will, you know, really help. Excellent. Sharing the learning. Good one. Nice. I like that, Karen. I like that statement, not to be so hard on yourself and trying to power through. I know exactly where you're coming from with that. Anything else? Yeah. Yeah, excellent. Yeah. Forget the brave face. They're brilliant. Denise, I don't know if there's anything you want to say from Unison's point of view, as you invited me in the first place.
Thank you. I mean, first and foremost, I would like to thank you and the whole of the Health and Wellbeing Group for all the work that's gone into this, and my colleagues in the other organisations. I certainly hope that this will not be the end of this. This isn't just going to be a couple of sessions and then we just move on to business as usual. And I will certainly be working with the Health and Wellbeing team with the support of my colleagues to continue with this, to reach out to see what support's needed, to adapt and change, and just to keep the conversation going, I think really is the big thing. And there is help out there. It's just about empowering our colleagues to reach out for it.
Thanks, Denise. Lila, anything else?
Yes, I just wanted to say, Alison, this has been so inspiring listening to you. I heard my colleagues rave about it last week when he did it, and I thought, I've got to be there. So they were quite right, and I think this is, we've got applause there. I think it's well deserved. And I think, you know, one of the things that I'm taking away from this, listening to everyone's contribution as well, is that we really need to be mainstreaming this, not thinking about it as a condition, but really thinking like, you know, when I started work a long time ago, safeguarding was a social worker's business and not ours. And then it applies to all of us, and that's recognised. Now, luckily, mental health is seen as everyone's business. And I just think that menopause and anxiety, for whatever reason, but if anxiety is there, then I think we need to have a much better understanding, everyone, about anxiety and how it affects concentration. And I suppose you'd expect me as a clinical psychologist to say that. I really want everyone to have a better understanding, because that's one of the things that affects memory. And so, you know, we really need to be just thinking about that, not just when someone has a problem, just really just making that mainstream, universal knowledge.
Excellent.
So, and I pledge, one of the comments I saw in the chat was that Dorset Healthcare doesn't have a menopause cafe or a Teams channel, and we'll certainly be looking at that.
Excellent.
Thank you, Alison.
Thank you. So yeah, that's the end of it, and hopefully, from looking at the pledges that were in the chat, then I'm very hopeful that the culture will start to be changed. So and Wesley, did you have anything else?
Yeah, just to thank everyone for making it to the second session. It's been a really tough one to plan and manage, as we have all seen. I just wanted to mention that we have a dedicated menopause page on our website. I'll be dropping the link shortly, so feel free to get on there, see the resources we've put together for you. And if you have any resources, as a lot of you have suggested via the chat section, you can send to us and we'll incorporate on that page. We'll also be sending the resources from this session that we've put together. That's the slide deck from Alison, the recording of the session, and any other resources that we've gathered both from the first session and this one. We'll send everything in an email to everyone who has attended, so you can just refer back to anyone if you need any help. And if you have any questions that haven't been answered in this session, feel free to send Alison an email, and I'm sure she'll be happy to respond. I'll drop her email address. Alison, do I have to go ahead to do that?
Yeah, go ahead. That's fine, Wesley. Yeah.
Late to ask now, isn't it?
As long as they're not too medical. I can't do medical, but I can do other.
And
So,
equally, Wesley, if you want to put my email address in there as well, I'm quite happy to take any queries.
Okay, and the last thing is our feedback form. We'd like to know how you felt about this session and what you think we can do better. So I'll drop Denise's email and feedback form right now as well. Please take out just a few minutes to help us with that. Thank you.
Thank you, everyone.
Thank you.
Bye.
Bye. Have a great evening, everyone.
Thank you very much. Bye.
Bye. Thank you.